Welcome everyone to a webinar on addressing childhood hunger in New York City through school foods. I'm Julia McCarthy. I'm a senior program officer with the Healthy Food, Healthy Lives team here at the foundation. And today I'm delighted to have Dr. Jen Cadenhead joining me for a conversation. So just as sort of housekeeping, we'll have a short presentation today followed by a question and answer period. Everyone is currently in mute mode, but if you have questions for Dr. Cadenhead, you can write them into the chat and I'll make sure to share them. So a little background. Dr. Cadenhead is the Laurie M. Tisch Center for Food Education and Policy postdoctoral researcher in food trauma in children. Her work has focused on understanding population diet quality and the consumption of ultra-processed foods. She's particularly interested in improving diet-related health outcomes among adolescents and women in underserved populations. Dr. Cadenhead received her BS degree in mathematics and sociology from Duke University. She received her MS degree in nutrition and public health, as well as her PhD in behavioral nutrition with a nutritional epidemiology specialization from Teachers College, Columbia University. She's a registered dietitian with clinical training at a variety of institutions, including New York Presbyterian Hospital and Kaiser Permanente Division of Research. And today, Jen is here to discuss her work with families, documenting their experiences with school meals during the pandemic. So much attention has gone to the numbers, which in no way should be glossed over. 2 million New York City citizens food insecure during the pandemic, 19% of New York State families with children wondering where their next meals will come from. But the numbers really only take us so far. And what I love about your research, Jen, is it adds a more human component to a very inhumane problem. The stories you've gathered, the work you've done documenting families' daily routines and their struggles can really help New York City school food continue to improve operations during COVID, but it will also have implications on the summer meals program and the future of PEBT, or Pandemic Electronic Benefits Transfer, which is a possible program through Build Back Better. So with that, I'll hand it over.
Thanks so much, Julia. I appreciate that. Warm welcome. And just a little bit about the Tisch Center. The Tisch Food Center conducts research on food and nutrition education, practice, and policy. And we translate our research into resources for educators, policymakers, and advocates to give people power to demand healthy, just, sustainable food. So a little bit of background on New York City public school foods. It's the largest school system in the nation, serving 1.1 million school children in 1,600 schools, or around 1,300 kitchens, because you can have multiple schools in a building, but usually just one kitchen. And kids can go to schools in their neighborhood or other neighborhoods. Over 75% of New York City school children are eligible for free or reduced lunch. And they've been getting universal free meals under the Community Eligibility Provision, or CEP, since 2017. The Office of Food and Nutrition Services is the Department of Education entity, OFNS, that's responsible for school meal services. They employ over 8,000 employees. They have over a $550 million annual budget. And before COVID, they served over 860 thousand meals per day. So some things to know: the pandemic grab and go meals were a response to the schools closing, which happened in early March or mid-March of 2020. And as I mentioned before, so many of the kids are on free and reduced lunch that it was known as really critical to be able to get meals into the bellies of kids. And this was, essentially a very new kind of service that OFNS was delivering, and that was a huge lift. And they offered three main types of meal services. So there was the traditional in-school meals for those few schools that remained open or at some later point actually opened. Then they also had the grab and go meals, which we'll focus on here in schools, and also available at community meal sites. And they offered these meals depending on the timing, the need, their staffing availability at 500 to 1,300 sites, various hours throughout the day. They were all open to the public. They provided halal, kosher, and vegetarian meal options at all of the sites. It's also important to know a little bit of historical knowledge about school foods in general. We knew that prior to the pandemic, New York City schools, as was true for many schools in poor districts, were actually underfunded compared to other New York State schools, and they were involved in litigation, which just recently got settled on that theme. And nationally, we know that schools are often in underfunded, school meals are often in underfunded schools, reflecting the neighborhood where they're providing the meals. And so even before COVID started, they were working with some tough conditions, limited supervision, a need for managers, a need for staffing. And then when COVID came along, that just exacerbated things. They also had supply chain issues and staffing issues, just like all of the essential workers. They had staff that got sick too. And then they had all these other new requirements brought on by the pandemic. The supply chain meant that you couldn't get what you needed, but grab and go had whole other requirements that they had to take care of. Ultimately, that meant that they had high fixed costs, which stayed the same pretty much. But because not as many kids were participating, that meant reduced reimbursement and increased financial challenges from all of the different components that they had to attend to. And I would just say some things to think about is, when you have food in the schools, you don't have to advertise. But when you transition to a grab and go meal, for instance, you have to advertise. And in New York City's case, it has to be in multiple languages. Basically, they were running the largest emergency feeding operation in the nation. That meant that they did have some buying power, being so large, but a lot of difficulties to overcome. So here's a chart of, in the lighter teal, what meal service kind of looked like before COVID occurred. And you can see, except for in the summers, it's averaging almost 900,000 meals per day, as I mentioned before. And then COVID hit and they completely changed the meal service. And that first week, they were basically, the transition was in March, at 130,000 meals per week. And they basically, you could say, built up from that number to average around 300 or so meals. Even in the summer, actually, you can see it went up compared to year over year in meal service. But still, that's less than what the number of kids that had been getting meals. And that's kind of what prompted this study. So here's an example of what the standard grab and go meal menu was when we were starting the study. So there was the standard daily options of grab and go options like peanut butter and jelly, cheese sandwiches, hummus, but then each day there was a different item also available. So for instance, here there was a panini with ranch carrot snackers on Monday. And then on Wednesday, they had the chicken tender wrap with dipping sauce, corns, peas, carrots, chickpea salad. And that changed for each day of the month. So in terms of our study, you had to be a New York City school parent who was 18 years or older and spoke English, and your child had to have participated in the grab and go meal service at least once since March of 2020. We recruited from our network of food partners with the Tisch Food Center. A lot of people from Lunch for Learning were referred to us, but we also tried to target participants by neighborhood so that we could get all over the city. And we use that by zip code using Facebook. advertisements. And parents who were eligible completed a survey about their children, their eating habits, food insecurity, their school meal participation, and their demographics. And then they were scheduled for a 1-hour focus group in Zoom. And if they participated in the focus group, they got a $25 gift certificate. And we had these focus groups May and June of 2021. So these were the questions that we asked. And they're mainly questions about barriers and facilitators for getting the meals. And then we had additional prompts for clarity. However, just in general, we let the participants lead the discussion. So not all the questions were probed to the same level. These were our main questions: what made it easy to get the meals, what made it hard to get the meals. And as we got through the rest of it, we got through it. Also, those questions were used by a research group in California, and who was performing a similar study. So here were our results. We had 250 people express interest in participating. Most of them were female. We screened and determined 127 of them were eligible. We got coverage in all 5 boroughs, nearly all of the community school districts. We wound up interviewing 101, again, mostly women, in 25 focus groups. And in terms of the big picture, most parents expressed a lot of gratitude. And this was especially true at the beginning of COVID, when there were fears over food safety, high unemployment, bare grocery store shelves, and even price gouging. However, the majority of them faced some barriers in picking up meals and acceptance of meals by their children. And that is really the thing that probably led to a reduced amount of participation, either in the types of meals or the number of meals. But focusing on what we really learned is that those who continued to participate were more likely to have locations that were really easy for them to get to. It was either right across the street, as this one participant said, or just a few blocks, like 5 minutes walking. For those families, they had clear communication. Often they mention parent coordinators reaching out to them, having things like class dojo, or the principal was just very in tune to what they needed. Some people said that their kids were picky, but they were still eating it. Those were often still adhering to the stated DOE menu. And other people just said that it worked fine. It was cafeteria food, not what they made from home. So that was their expectation. Just would like to remind people that we only interviewed people who participated in the grab and go meals. And when we think about the original numbers, something that many of the participants mentioned was that there were family and friends that, this was May and June of 2021, who were not aware that the program was going on still. Either they missed the communication, or they never saw the communication. Okay, and here are some of our quantitative results. This one's the reported food insecurity by borough. We noticed there were differences. Before the pandemic, here we see Staten Island had the lowest amount of food insecurity, and Brooklyn and Bronx were kind of tied. But nevertheless, when the pandemic hit, the early part of the pandemic, nearly everyone was experiencing some type of food insecurity issue. And by the end of the pandemic, we see there was actually a difference in recovery. Also, Brooklyn nearly recovered, although there's still fairly high levels of food insecurity. And the Bronx was much more likely to still be experiencing very high levels of food insecurity. So interesting there. And then we also, one of the questions we asked about was fruit and vegetable consumption. We have a similar chart here on vegetable consumption, but here you see the fruit consumption changes by number of pickup days. So if people didn't change the amount of days or increase the pickup days. They were pretty much, having similar amount of fruit consumption. But if they decreased the amount of fruit consumption, they were much more likely to see their children decrease their fruit consumption by a lot. And like I said, there's a similar chart for vegetable consumption. And then we note here that this is a number of days that families were participating in the program. We found that 70% were participating 4 or 5 days before the pandemic, and about 20% were participating 1 to 3 days, and about 10% of those who we interviewed were not participating before the pandemic. And then we find that when the pandemic first started, the number of people saying they were participating 4 or 5 days dropped quite a bit to 40%. Then we have a lot more people participating occasionally. And then I guess there was even a decrease in the number who weren't participating at all. In summer, we found still fewer participated 4 or 5 days. It was a little bit of a drop or increase in people who were not participating during the summer, which I think is consistent with just the pattern in general. Again, it might be a communication concern. And then when school started, we never really see the number of people going back to 4 or 5 day participation, but we do see a lot of people participating occasionally. So in terms of participation recommendations in increasing participation, the things that the families told us that really helped them to participate was one, signage and having two-way communication. So I mentioned the parent coordinator or emails, having flexible pickup times, because sometimes the service time had changed so that there was a conflict between watching your kid and getting food. So when there were times where they could get there, they really were able to do that. Having welcoming locations, like knowing where to go in the school. These are all little details that are hard to necessarily know people are having problems with, but they really made a difference. Pairing them with services. So again, I mentioned, I think PPE and sanitary napkins, or just other kinds of services that was really a draw. So not just to get the meal, but also to get something else that was a draw. And involving and communicating with families in real time. So going back to also having the option of a parent coordinator. Sometimes they were texting people, telling them, okay, we know you like this, come for this now. Bulk meals and home delivery and different kinds of pickup options were also really well received for many of these families. And then in terms of increasing satisfaction, which I think is different from participation, many people felt like when they felt like the meals were delivered with a personal touch, it made them much happier. Having the ability to provide feedback from families would be welcomed. Also having consistent variety in terms of preference, all kinds of preferences and allergies will go a long way towards increasing satisfaction. And many families also mentioned it would be great to include New York City culinary expertise to increase the variety if it's a cold meal, and hot grab and go meals. Really, really love those things. So in terms of key takeaways, I would say families were participating if they found it easy to participate. And what I mean by easy is it was like easy to get to, easy to be part of their life. If their kids wanted to eat it for whatever reason, those things increased participation. If it became a pain point in any way, shape, or form, I think families had so many things going on that would reduce participation. And in terms of benefits and challenges, we saw that when there was higher participation, there was higher diet quality. And also people mentioned when they were able to have higher participation, it lowered their financial burden. which is always great, especially in a district like New York City. And just being cognizant, it may be impacted by other factors. So maybe they missed the New York one announcement, or they had a sick relative to care for, or, there's so many different things going on that we didn't ask about and we're not sure about. Also, thinking about from the OFNS point of view, that meal service was really a completely different thing from what they have ever done before. And there were lots of extra challenges. Foremost of that was communication, probably. You don't have to communicate that meals are there when kids are in school. They usually know that they're there. There were lots of higher costs, supplies, supply chain issues, staffing issues on top of what they already had to deal with. And probably lots of other challenges as well. Like I mentioned, having a history of underfunding. So in terms of policy implications, I would just say that, again, school funding was not really adequate for many districts before COVID, and just making it a priority, it needs to happen. There should be targeted state, federal, local funding and technical assistance as needed available. I'm happy. I heard about the 25-cent increase for in January, but I suspect that that's actually not going to go that far with food prices increasing. Also, we know that including student and family voices is always a good thing, but baking it into the process is probably a great thing too. And of course, I don't say this just as a researcher, but it's good to actually do real research so that you do know what's going on. And here's my email address if anyone would like to email me afterwards, but I will just stop sharing now.
Thanks so much, Jen. That's great. I think two things that struck me that seem really, really important were that higher participation equals higher diet quality. And I think that, there's a lot of rhetoric in the media talking about supply chain issues and quality of sort of public meals. And, we know as people sort of steeped in school meal research that, children who eat school meals in regular times have better diet quality than children who don't. And, it's amazing to have another data point showing that, even during COVID, with the supply chain issues, with the labor issues, that still remains true. And I'm wondering, if you have any comments of that, or like how you would attribute it. That's not a formal question, but just a great point to pull out here. I think that's really important.
Yeah, I think that's one of the reasons why we actually do need school foods, because we want our kids to be healthy. Like the reason school foods are a part of the federal policy to support it is because we couldn't have soldiers that were fit to fight in the military. And
historically, right? Yeah.
Yes, historically. So it was a reflection of the fact that our kids in general are malnourished. We don't tend to, probably, I'm not sure who's in the room exactly, but generally speaking, the public doesn't see obesity or overweight as being a problem of malnourishment, but actually it is. We know that school foods provide are adhering to nutrition standards, and probably for many of these kids, these are the only fruits and vegetables that they're eating during the day. And they really,
this point I think is especially important, just to sort of put a fine point on it. With the Trump administration had tried to roll back some of the school meal standards, and actually we're hearing that USDA is going to release a new rule rolling back the rollback. So basically like reinstating Healthy Hunger Free Kids Act requirements. And I think that, this is one more data point that shows how important that is, and why school meals need to be healthy. But I want to back up a minute. So we talked, here specifically about New York City families. And, we know that families in the Big Apple, because of the city's density and scale, obviously have a different experience from, say, families in the Hudson Valley or in the North Country. We're the New York State Health Foundation. So we're curious not just in what's happening in New York City, but we want to know, are there common experiences or takeaways from the study that would apply to families and school districts across the state?
Yeah, I mean, I think probably there's a lot that could be thought about. The first thing I would say is that if people don't know about the meals, they're not going to eat them or get them. So finding ways to make sure, like, it applies to New York City and everywhere else. All messages, it should be on blast. Like, the principal should be making that announcement every day. And we have these meals. If school is not in session and they're having some kind of pickup for it. And the teachers at the beginning of every lesson, they should be announcing, and we have these meals and they're available. I mean, because we have these waivers through the end of this school year. Families need to know, and taking it for granted is maybe at the peril of the school meal service. Mm-hmm. That's the first thing. I mean, there are other things too, I would say, but just like you said before, promoting the fact that they are available and they are nutritious. And just like when parents have their kids in school during the regular school year, they can depend on these meals as providing great nutritious meals for their kids. So
yeah, we have a question actually from the audience. Relatedly, it said, what were the role of food banks and community organizations in advertising these meals? Did you hear from families that was how they learned about meals? Was that an successful method of communication?
Yeah, actually, that's a good question. We didn't ask that question exactly. The way I guess I could maybe comment on it is that it didn't seem that the like food banks or food pantries were advertising the meals, but sometimes they would be available with the meals. Like sometimes they would set up a box drop and people would actually come and get those food boxes from the food pantry and the school meals. It would be a draw for them, but I don't think they were really working in cooperation with school foods to say that. I think there was this assumption, and I don't really know, that would be kind of assuming of me, that people knew about the school meals. So they would just worry about their food pantry or their food bank or whatever. They were just advertising their stuff.
I mean, something you and I have talked about previously is sort of revisioning how these meals are as an entirely new program, right? That there's a way to think of it as like school lunch service happens in the cafeteria, COVID hit, school lunch service continues, but through grab and go. And another way to kind of think about it, and if you think about it from that, we say like participation dropped, that people potentially went hungry who relied on these meals. And another way to really conceptualize it is school meals stopped during COVID.
Yes.
And the school district had to launch an entirely new program.
Exactly.
And from that, if you think about it as launching a new program and reaching 300,000 some students within the first month for families, you would actually measure that program as a success. And so
yes, right.
Can you talk more about that? Because I thought that was such an interesting point you made.
Yeah, I mean, it was a completely different program. So you do not have to advertise a school meal when school is in session and the kids are there and they know the cafeteria is there. And when you had the rollout of grab and go, where you're asking families to come and pick it up because it's not part of their regular routine, it's a completely different thing. It's like you're opening 1,300 new restaurants and saying, hey, we're open for business and this is what we have available. And, you have to do everything that's associated with opening a new business. So yeah, that was, when I say it's a huge lift, really what I mean. It was a completely different thing from what they were doing.
And it strikes me like we've spent quite a lot of time talking about communication, right? And we have another actual question sort of from the audience saying, our families told about this when they're applying for SNAP. What are the role of community groups? And it seems like maybe a miss at the federal level was not initially providing money for communication about the change.
Or
do
all
you think
the other
that's a
things.
federal level issue, a state level issue, a city level? Like, what should we all be doing
Well,
in the future?
yeah, I'd have to push back and say that's a question for research, because I honestly, I don't know.
Yeah. It seems to me though, like if you're, big corporations get marketing money when they launch a new product. And so if you're launching a new program, having money to be able to talk about it is very important.
Yes, it absolutely makes sense. I would say it would be better to actually know how much money you would need, or that's what I say, technical support is needed, because no one knows the answer to that. And so someone needs to figure it out and help people, because it looks like we're going to be living with COVID for a while. So, these are just unmet needs, and there's probably lots of other unmet needs.
Another thing that, I know that you've looked into and we haven't quite talked about today is pandemic EBT. Can you explain a little bit about what that program is, and then, sort of general feedback about what students and what families were feeling about it?
Yeah, so the pandemic electronic benefit transfers were funds set aside for kids in either you could be in a CEP district, community eligibility. I'm getting tongue-tied. You could be in a free school, all free meal school district, or you could just qualify for free and reduced lunch if you weren't in that district. And they would give parents money for each day that the kid wasn't in school getting a meal, to compensate for the fact that the parent had to pay for the meal, basically. And in New York City, or I guess in New York State in general, they gave that money to families in chunks after the fact. I mean, I guess it takes a while to figure out how long schools were in session, and then the way they decided to send out the money was to, if you had a SNAP card, they put the funds on the SNAP card. And then certain people got new cards in the mail. I think, it was a huge success for people. Everyone who I asked about it and had generally used the funds, all of the funds. Many people, especially if they had older children, because school meals, although they're great, are not really all that. It's sometimes for a high school boy, if you have 3 middle school and high school boys, it may not be enough to really fill them up. So the PEBT, especially for families with large families, growing families, kids that eat a lot, and they seem to, in the pandemic, I heard this time and time again, eat me out of house and home. A lot of people were just eating. Often terrible food, but they were eating, when they're not eating the school meals. So this just really helped to alleviate that strain financially for a lot of families. There were some issues with people not always being aware that the benefits were there. Different issues like that. So having more communication about the benefits rolling out could have been very helpful for people. I heard a lot of, oh yeah, my girlfriend told me that this was available and I should go check my card. And I found out and I was really thrilled.
And we're not talking about small amounts of money. This is like $420,
yes.
right? Like significant benefits, especially when compared to normal monthly food stamp amounts.
Yes. Right. I mean, it was, I don't know, at the point where the PEBT came, also, I would say if they could have gotten the money out to the families a little earlier, it could have been even more beneficial, because at the point where some of the benefits were being rolled out, other benefits were being rolled out. And so some people weren't even aware that it was necessarily a PEBT benefit. They just knew that they were getting money from the government, but they didn't know what.
We have a question from the audience asking, is there overlap where families were receiving both grab and go school meals and PEBT for the same days? And if so, did they talk about that? And what was that experience like?
No one told me that. I mean, again, many people dropped off in participating. I suppose there could have been some overlap, but I think I didn't really actually get any reports of that. And again, people just needed the money. So
yeah, as I understand it, you were, as a family, eligible for both. So you could be picking up grab and go meals for your children, day to day, or you could be using theoretically using PEBT for those days they're out of school. But because of some difficulties in, number one, the federal government approving the state plan for PEBT, because the state had to say, like, we actually have identified people, we know how we're getting at the money, here's how, we're using these funds responsibly, essentially, that the approval from the federal government took a while, the state coming up with a plan to identify people took a while. And so actually many families were getting this 9 months after, some of the second benefits, 9 months after they'd actually missed school.
Huge delay.
So it was filling a gap, but they weren't actually using it simultaneously because of sort of bureaucratic delays. And obviously, like, the state and the federal government were, just like the city government, sort of like pulled at all ends, right? Like they didn't have time to come up for air because there was so much to do.
Everyone had a lot of extra stuff on them.
I mean, one of the things I think is really helpful for understanding why people liked PEBT so much and what worked about it is that in Build Back Better, should it pass at the federal level, there actually is a provision to extend what's called summer EBT. So it looks a lot like pandemic EBT. It's essentially a benefit that families can use when school is out over summer, or, I guess similarly now. And are there takeaways? Like, was it more convenient to use? Was it a bigger benefit because it includes the labor cost? Could they buy culturally relevant foods? Like, did you hear things like that?
Yes, all of the above. I mean, I would also say that it's hard to accommodate everybody's diet. And so, like, especially people who had kids who had food allergies, maybe you don't want to take a chance with certain meals. And that made it a lot easier for them to be able to shop for their specific needs and know that their kids were getting food that they would eat. Also, for the people, not everybody understood how to use the benefits, but some people did understand, like, they could use it for online groceries in certain situations. So just like, I don't know, more education, more communication on these benefits too. Like, I don't know if you would coordinate with schools to help families understand how to use them. But, for the people who understood everything about it, it was 100% blessing for them. And the other people maybe eventually got it. Some people did report that they got cards for or benefits for some of their children and not all of their children. So I'm not really sure if there were some technical difficulties going on there or not. But having easier ways to interact with customer service could have been helpful too.
And to circle back to the question earlier about sort of what is the role of community groups, food banks, et cetera. I know that community food advocates the New York City government, actually, the Tisch Food Center, and many sort of other partners were doing huge outreach around PEBT because so little was known. And I
Right.
had
Right. But
actually
yeah,
joined the-
but right. Should that be a community task? I don't know. But yeah, community food advocates and lunch for learning. I mean, what if they weren't there? I'm not sure how many people they reach. Maybe somebody who's on the in the audience could comment on that. But were they like the stopgap measure for people understanding the benefits? They are great benefits, like I said, like probably other people who talked about them, 85% did understand and get it. But there were a number of people who, like, I think the issue is that one, going back to that communication issue, not everybody is English literate. And not everybody is highly literate, and not everybody is tech savvy. And a lot of these things relied on like internet access and communicating things via internet or whatever. And not everybody has access to those things.
Yeah, and I mean, I think that's a point that's been made abundantly clear through online learning too, that there isn't, just like there's inequitable access to food, there's inequitable access to internet services, sort of like neighborhood resources, and that severely limits people's ability to take advantage of these programs that are available to them. I want to shift a little bit just in the sort of remaining few minutes and talk a little bit about, we understand that, families were really struggling during this time, and that school food service staff were working tirelessly to help. But there were still these barriers to getting school food. And, what can lawmakers at the state level be doing to support the school food staff, coming into this year, coming into next year? What's their role here?
I think they probably could take a long, hard look at how they're funding these programs. Are they funding the programs so that, they have the staffing they need, the managerial staffing they need, the technology they need? Just like, can these operations run as efficiently as a restaurant? Like, if you're expecting restaurant level service, what are you doing to help them? I mean, like right now, probably lots of schools, and this is not just New York City, this is everywhere across the nation, are probably pretty low on the totem pole in terms of bidding for food. And should our nation's kids be subject to the whims of commercial industry that way? Or are there ways that we can incentivize food manufacturers? Or I don't know the answer to that, but are there ways that they can help in that process, and help each entity run more efficiently?
So I think, we'll wrap up a little early at this time, but just, I guess, a final question for you, Jen, would be, what can we do as professionals, as parents, or as interested listeners to ensure that, students across New York are getting healthy, culturally appropriate foods?
Well, I would say two things. One, I would say right now we have in the Senate a bill that's languishing. I'm just a bill. I'm sitting here on Capitol Hill. Yeah, for those of you who know that song. Maybe I'm revealing my age there. Anyhow, Build Back Better, supporting that. That would be good to let your senators know, even your congressman, just to know that you support that. And then also just, writing the governor as she's planning for the budget. I heard recently that New York State is awash in cash, which it's like, wait, that's a nice place to be. How about helping our kids? So telling your lawmakers that you care about school nutrition and you care that it gets adequately funded will go a whole long way towards helping this.
Well, Jen, I want to say thank you so much. We really, really appreciate the time you've given us today, given us lots to think about. And, I look forward to sharing more of sort of these publications that you've worked on, and just, hope that people can have learned today, and we'll put you in touch if they have further questions. So
Okay.
thanks again.
Thank you. Thanks for having me.